the first session is a debate. So for the debate, I call upon the speakers, Dr. Arun Menon and Dr. Kaushik Pandit, and the moderator, Professor A.K. Das, to the dais. The speakers and the chairperson's introduction and the CV has been displayed. So I request the chairpersons to just introduce the speaker briefly so that we can save the time for the scientific session and the discussion. Thank you.
Dear friends, we are in for a great debate. The non-calcemic effects of vitamin D, another vitamin bites the dust. To say in favor of the motion, we have Dr. Arun Menon from the Amrita Institute of Medical Sciences in Cochin. And to oppose the motion, we have Kaushik Pandit from the Bellevue and the Fortis Hospital from the city of Calcutta. Dear friends, it's going to be a very exciting, sparkling debate with absolutely scientific, evidence-based presentation. I must mention here that the organizing committee has allotted 10 minutes for each. I'll be giving a bell at the end of 9 minutes, me or my colleague. At the end of 20th minute, Arun will get a chance to rebuff what Kaushik has said for 1 minute, and Kaushik will also get a chance for 1 minute only. After that, as Krishna mentioned, we have 12 minutes, a great time allotted for the discussion. And then I will sum up at the end of it. Dear friends, suffices to mention that the non-calcemic effects of vitamin D is one of the most important contemporary issue. To say that these non-calcemic effects are possibly biting the dust, I will invite now Arun Menon to speak in favor of the motion.
Good morning, friends and colleagues. So the first debate, I'm very pleased to be the first speaker. The non-calcemic effects of vitamin D, another vitamin bites the dust. I'm here to support that motion. Now, at the outset, let me tell you that I'm neither naive nor foolhardy to completely sag off vitamin D. We know the skeletal effects and the significant difference vitamin D has made in terms of the skeletal effects. But I think today is about the non-calcemic effects of vitamin D and where we stand in terms of the evidence. Now, if you go back to 1920s when the vitamin D was discovered, since then there's been significant amount of research that has gone into vitamin D, elucidating the effects of vitamin D and looking at vitamin D supplementation. And this is, if you can see, a slide from 20s. And you can see the sort of optimism and euphoria that was there with cod liver oil, which obviously contains vitamin D as well. Now, the real optimism came when Michael Holick went on the sort of, looking at the vitamin D effects and the benefits. And I think if all this was true, then most of us sitting here wouldn't have a job today, because you can see that it pretty much covers all the effects, all endocrinological and rheumatological disorders. If vitamin D was a solution for that, then a lot of us would be out of job today. Now, why was there so much of optimism and euphoria? Largely, there are a number of reasons for that, but largely because you know that vitamin D receptors are there in most organs, and there are a number of genes, more than 200, which are regulated by the nuclear effects of 125 vitamin D. So clearly there are very important points perhaps to suggest that they might have effects outside the skeletal system. And to take that further, the anti-inflammatory effects of vitamin D in vitro as well as in animal models are very well proven. The immunological benefits, again, a very exciting area for in vitro studies and in animal models. The beneficial effects on insulin resistance, another very important point. But all these, let me tell you, friends, it's all still in vitro and animal model studies. So, because of all this, there was a lot of optimism and it was implicated in a number of disorders. Now, I'm not trying to list everything here, but the important diseases, chronic diseases that we thought vitamin D has an effect were heart disease, cancer, diabetes, neurodegenerative diseases and demyelinating diseases like multiple sclerosis, and on mortality. Now, let me show you the evidence one by one just to see where we stand in terms of this now. So what about vitamin D and overall mortality? There is very good evidence linking low vitamin D with excess mortality in chronic kidney disease patients. So it is just the low vitamin D and excess mortality. The studies are retrospective trials. Okay, and even the vitamin D supplementation has in this group shown a decreased mortality. But again, retrospective studies, let me tell you. There are no randomized prospective trials examining this relationship. Okay? So all we are saying is low vitamin D is linked to mortality. Low vitamin D, excess mortality. That's all. What about heart disease? Again, the correlation is through observational studies. There is correlation that low vitamin D exists in people with heart disease. So there is an excess of that group. Again, no large randomized trials at all on the cardiovascular endpoints. No wonder that there are no screening recommendations coming out of that. Clearly, you know that all authorities, you look at whichever authentic authorities, nobody has come out with any recommendations of vitamin D screening in heart disease. Now, what about diabetes? Without going into too much of details, there has been link of low vitamin D with type 1 diabetes, type 2 diabetes, and metabolic syndrome. But again, all are observational studies. So the question is really, is vitamin D a confounder or is it really the culprit? To add to that, the neurodegenerative and the demyelinating diseases like multiple sclerosis, again, low vitamin D is associated with it. But there is very weak evidence of the decreased exacerbation with vitamin D supplements. So you supplement vitamin D, there doesn't seem to be that significant effect, at least in studies. Now, the most important of them all, the cancer. This is where there was so much of optimism years ago. And the WHO the research, cancer research group came up with these conclusions in 2008. And I don't think we have got much more evidence after that. It was clear from observational studies that there was a link, but there was limited evidence of a causal link. So whether, to say that vitamin D is the causative factor or the main reason for cancers, there is really no evidence to say that. Whether you take colorectal cancer, breast cancer, prostate cancer, or any other cancers for that point. So they concluded that vitamin D status, yes, that is linked to, the low vitamin D status is linked to cancer, but you need large randomized studies. Now, let me just, in the last few slides, conclude by looking at one big meta-analysis that came out earlier this year. And it was clear in that the conclusion was that looking at all the studies that have been there, including observational studies and interventional studies with vitamin D. Low vitamin D seems to be a marker of ill health. That's all, okay? There is no real link to show that that is a causative factor. Now, just to focus your attention on the far right-hand side, if you look at the prospective cohort studies. Low vitamin D, yes, it is linked to cardiovascular disease, diabetes, cancer incidence, all-cause mortality. But look at the top right-hand corner. The trials with significant change in favor of vitamin D supplementation. And look at the data. Can you see, I mean, there are hardly one or two studies that are showing that vitamin D supplementation would actually make things better. And that's the case whether you take all-cause mortality or diabetes or insulin resistance. And the most important, as I said, the cancer, again the same picture. Low vitamin D associated with cancer, but really nothing to show that supplementation helps. Okay, so what are we saying then? The low vitamin D is definitely present in chronic diseases. So there is a clear-cut correlation, or there is a link between low vitamin D and chronic disease. But they're all from observational studies, not from RCTs. And that is a very, very important point to note. And this does not establish cause and effect. Now, why should we be concerned? There are many reasons for this, because only in the last, say, 2 decades or so, there has been a lot of optimism about vitamins. There's always this feeling that vitamins are always safe and there's nothing to worry. But look at least 3 examples here. Beta-carotene. Now, it was touted as a protector of cancer. And what happened? The studies actually showed that it increased lung cancers, and they had to stop the study early. Vitamin D supplementation, again, vitamin A supplementation, again, increased risk of cancer in those studies. Now, nobody knows the reason, but increased risk, and they had to stop the study. Vitamin E, again touted as a cancer killer in prostate, but there was increased prostate cancer. Thank you. So, no wonder then vitamin D is on trial, isn't it? I mean, there are any number of large trials. This is after 90 odd years of having discovered vitamin D. We are still in the process of trying to prove that it has got effects beyond bone health. So what's the future for vitamin D? I mean, let's be very honest. There are large barriers for a primary prevention trial, because it would be deemed unethical to not to give vitamin D to people who have got low vitamin D deficiency. Not because of non-calcemic effect, but because of the skeletal effects. So that in itself is a barrier for large studies to prove a point. It is very convincing that it is a marker of ill health. Nobody has any doubt there. But supplementation hasn't shown any convincing benefits, and that is where the issue is. So I request you to support the motion that another vitamin bites the dust. Thank you.
Thank you, Arun. Thank you very much for putting your points in favor of the motion. Now it's my great pleasure to invite Dr. Kaushik Pandit to speak against the motion that the vitamin D non-calcemic effects has not bitten the dust.
Respected moderator, sir, my respected and honored opponent, Dr. Arun, respected seniors in the audience and dear friends. It's indeed an honor to have been invited to talk on the opening session of this great Trendo 2014. Well, I have been asked to oppose the motion. I'm afraid the audience may be a little bored because I'd repeat what Arun had already said, and much to my favor. Well, let's start the story a bit early, a bit of an history. When vitamins were discovered for the first time, it was in the last century when Eichmann, working on the prisoners, had noted that there are some substances which are required in a very small amount and which is essential for maintaining health, which was later picked up by Dr. McCollum, who discovered vitamin A, and it is he who was credited with discovery of vitamin D once again. So what are the vitamins? Vitamins are necessary in small amounts for normal metabolic functioning. They are usually not synthesized, or the rate of synthesis is not sufficient to maintain health. But here, so far as vitamin D is concerned, despite the fact that it's called a vitamin, it acts more like a hormone because it's synthesized in one part of the body and transported to the other part to exert its function. So To separate the vitamin and hormone, we may once again recapitulate that vitamin D is synthesized in the skin, transported in the blood, activated by a tightly regulated enzyme, and active form binds to specific receptors present in target tissues. So where are the target tissues? Well, it's almost omnipresent. If we look into the vitamin D receptor proteins, it's present almost throughout the body. So if it is present throughout the body, it must have some functions throughout the body. And if it is present beyond bone, it must have functions beyond bone as well. These are the early days, and probably we are not in a position to comment on what are the actual functions of vitamin D throughout the body. And what are the functions? Well, it has got multitudes of functions. It's unfortunate that we really do not know all the functions to its entirety, but at least we can guess that there are many, much more beyond the bone. And that's the moot question that we have to decide today. So we have effect starting from brain to muscle and various cardiovascular, pancreas, immune system, cancer, etc., etc. And we know that 1-alpha hydroxylase has got a calcitropic effect and a non-calcitropic effect through various other organs as well. Well, the ball started rolling a little earlier in the year 1985 when an innocuous paper noted for the first time that vitamin D, dietary vitamin D, is associated with the risk of the colorectal cancer, and that started the snowball effect. Later on, paper after paper, reviews after reviews had shown that with Kaplan-Meier survival curves with various types of cancer, with vitamin D and calcium are very strongly associated. Similar things are seen in other conditions as well. In fact, vitamin D is associated with total mortality. It's not merely only one disease. Vitamin D is linked to cardiovascular disease. We really do not know the pituitary mechanism, but there are some possible association with increased PTH, which leads to inflammation and increased activation of RAS, and probably that puts a person with vitamin D deficiency at an increased cardiovascular risk. Vitamin D has got an effect on the endothelial function, so it starts pretty early, probably. But that's not the end of it. And whatever my opponent had said that these are all observational studies, case studies, that's probably not true. We have got multitudes of other evidences, especially from prospective study, where the health professionals follow-up study without any cardiovascular disease with low vitamin D, there is a strong association of increased risk, more than nearly 2.5 times the hazard ratio. The celebrated Framingham offspring study once again had shown that the risk is significantly higher with vitamin D deficiency as well. Another study which had also shown low vitamin D is strongly associated with cardiovascular disease. So here comes diabetes as well. So vitamin D is associated with diabetes. A bone vitamin, so to say, associated with a disease which has no relation so far as bone is concerned. And this particular study is a relatively large study, double-blind randomized controlled trial, had shown a significant number of newly diagnosed diabetes coming out of people who have got vitamin D deficiency. And lo and behold, it is also associated with type 1 diabetes as well, because we know as of today that vitamin D has got an effect on the insulin secretion of the pancreas, as well as in metabolic syndrome. It also has got multitude of effects on other systems as well, like tuberculosis. And people who are vitamin D deficiency and have been supplemented with vitamin D shows a much better outcome who have got tuberculosis. I guess I could go on and on and on, but probably that will bore you to death. But if we summarize, there are other associated diseases like autoimmune diseases are associated with vitamin D deficiency or insufficiency even, multiple sclerosis, polymyalgia rheumatica, rheumatoid arthritis, thyroiditis, autoimmune polyendocrine syndrome, SLE, etc., etc. It took us a long time to come from a geocentric concept to a heliocentric concept. It took us centuries to understand that despite the fact that we are the most important, so to say, object in the universe, the whole world is not revolving around us. So it's time that we also have to modify our thinking, as if I am allowed to quote this one, when the facts change, I change my mind. What do you do, sir? So if the evidences are in favor of something, irrespective of the fact that we have to accept that whatever we have known till today, that a vitamin which is linked to bone only, probably, putatively, has got other effects. And may I also point out that just because it's early days, we really do not know how much of vitamin D is important in cardiovascular disease. We are trying to look at vitamin D today through the glasses of bone. I mean, we are thinking of vitamin D levels and the low levels, high levels, measurement, everything in terms of so far as the bone health is concerned. But we really do not know what is the ideal level or the optimal level so far as the cardiovascular disease is concerned or diabetes is concerned. So if that be so, but if the evidences show that vitamin D has got definite non-calcemic effect, irrespective of the fact whether it is early days, irrespective of the fact whether you have got n number of evidences, we have to accept that vitamin D definitely has got effects beyond bone. We must come out of of this one nutrient, one disease concept. Vitamin D has got an pleomorphic effect. That's definitely irrefutable evidence. Vitamin D is definitely have got an effect beyond bone. It's another issue whether you call it a vitamin or vitamon or whatever, that may be in semantics. But there's no debate on the non-calcemic effect which has not beaten the dust. Rather, I can think of that my honored opponent may be thinking within himself that vitamin D definitely has got an effect which is beyond bone, but he has to bite his tongue. I'll thank you and wait for your comments. Thank you, sir.
Thank you, Kaushik, for putting your points against the motion. Now, Arun gets 1 minute to rebuff, if you want to. And you will get 1 minute after.
Thank you. No, I'm not going to refute any of the evidence that Dr. Kaushik has shown here. But you would have very keenly observed all the slides there. Did you see any interventional study of vitamin D that has shown benefit in terms of chronic disease reduction? We haven't. Yes, there is evidence to say that low vitamin D exists in chronic diseases. Yes, that's there. Low vitamin D exists in chronic diseases. But intervention has so far not shown, despite so much of studies, hasn't shown any evidence. I think to me, this is like, I'm a very ardent cricket follower. And most of you would know Rohit Sharma, who was an immense talent. And I've followed his career for the last 10 years or so. There's been promise from the start, but he has never delivered so far. So I think it is difficult to look at the scientific evidence and to say that there is still life left in vitamin D.
Thank you. Thank you, Arun.
I guess the audience has not forgotten that I have shown three prospective studies. One intervention studies and Women's Health Initiative where vitamin D was supplemented and had shown significant benefits so far as development of diabetes is concerned. I do admit that there are not many intervention studies in all aspects of vitamin D, but certainly some evidences for intervention and multitudes of evidences for deficiency. I'll stop here and thank you.
Thank you, dear friends. Now it's my duty to put the motion into vote by raising your hands, and I'll try to count it. Dear friends, first of all, may I request those of the esteemed audience who believe in what Dr. Arun has presented that the non-calcemic effects of vitamin D has beaten the dust. In favor of Dr. Arun, please raise your hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 17, 18, 19, 20. Yes, good. Now, may I request those of you who believe that the non-calcemic effect of vitamin D has not beaten the dust, who are in favor of what Kaushik presented, please raise your hands. 1, 2, 3, 4, 5, 7, 8, 9, 10. It's a little more than what we had raised hands before. Dear friends, we have two important issues. That is the beauty of this particular debate in contradistinction to other debate. Now we have almost 11 minutes for an interaction. Now, dear friends, I will invite one by one those of you who want to make any comments. As Krishna said, very brief comments and equally brief answers, either from the speakers or from anybody in the audience. May I open the topic for discussion? Yes, yes, sir. Please start. Very brief and.
At least the paper, Dr. Das, is from central government institutions. So the question is to you, do you routinely measure vitamin D? Because we talk a lot about vitamin D. There are reports that even in GDM, vitamin D can calcium
I get your
supplement.
point.
So do you routinely measure vitamin D? And if suppose the medical science is so advanced that hardly any healthy individual is left in the street.
Yeah.
So if you measure vitamin D, all of us, you and me, maybe, I don't know, will be will not be healthy.
I get your point.
So whether
I will answer the
how
question.
do you intervene? See, we think that this is a public health intervention, but what happens is that this kind of stages are being abused.
Okay,
By the nexus which you people have with the industry, so everybody is starting giving prescription.
Okay,
so what are the side effects? What is your the voice from not the individual voice, the body's voice about vitamin D measurement? How do we replace this? This is otherwise this is being exploited or abused by the.
Okay. I think the question is very relevant, and the answer to that in our institute we were not routinely measuring the vitamin D. We have just started measuring. Any other questions, discussion? Yes, doctor, behind you.
Dr. Vijay Kumar from Trichur. I'd like to just make a statement here which is really not within the scope of the debate itself. Why should we not ask ourselves in the first place, why is vitamin D deficiency occurring? And can we put it, if we were to put it amongst one of the lifestyle changes and lifestyle diseases, then the very same lifestyle changes and diseases could be responsible for all the morbidity that we have just,
okay, fine.
Dr. Arun has mentioned.
Anybody would like to respond
and
to
that
this?
would mean there is a correlation.
Dr. Vijay Kumar, got your point. Anybody like to respond to that? Why don't you talk and can it not be lifestyle? Avoid the changes. Please get ready with other questions and the points for discussion.
Well, vitamin D related to lifestyle is not really known. I mean, but this is an undeniable fact that India, especially this country, is having a large burden of people with deficiency of vitamin D. Whether that is the causative effect of or the engine for increased number of diabetes or cardiovascular disease that we see in our country is not really known. And as I've said that these are early days and it probably will be too much to expect to come to a conclusion based on this limited amount of data.
Yeah, I think thank you what Dr. Vijay Kumar referred to was the exposure to sunlight and the physical activity and the right type of food which can take care of it. But the fact remains that in certain population like the elderly, like the pregnant ladies or the growing children, the deficit does exist. Yes, Gopal, Jayashree.
Yeah, I just had a question. I think you sort of answered it. I was asked recently, do we need to make vitamin D measurements as a part of the master health checkup? And I just wanted the views of the panel. What is the evidence that measuring vitamin D, apart from our usual indications, which is for osteomalacia, bone pain, is there any other evidence to say that measuring and treatment helps? And what would the panel do? What would you do?
I think this is very important. As the first, I think the first questioner and this question hits the bullseye. What is your opinion regarding the routine estimation of vitamin D in the master checkup? Yes, first I'll ask Arun to respond.
I think Jayashree, as you have said.
Yeah, you'll be audible.
As you have said, I don't think there is any screening recommendations and there is any definite evidence to do screening as part of a checkup. And I think I'm sure that's what almost all of us do, because that's not backed by any evidence.
Thank you.
Just to say that.
just to extrapolate the evidence that we have seen from PSA and prostate cancer, and it had shown that screening with PSA really does not decrease the mortality from prostate cancer. This may also be true so far as vitamin D is concerned as well. So screening with vitamin D, we do not have enough evidence to suggest that it will alter the course of the disease.
So I have a question. Yes, I'm coming back to you, sir. 1 minute, sir. 1 minute. So the opinion expressed is that there is no room for a routine screening of vitamin. Yes, doctor.
Dark skin persons are protected from entry of sunlight into the skin. So, and light skin persons, they get more penetration. So, are we justified in having the same level of serum vitamin D for Westerners and Indians? Are we in a chronic adaptation state of low vitamin D levels in India? What's the difference?
I got your point, doctor. The issue is that whether the high melanin content in the skin is the one which decides about what is the normative values of vitamin D in the dark people and whether it is different. Yes.
Excuse me. Yeah, I have got a comment to make. This vitamin D, I have seen 2 cases in the last 3 months where there was a hypervitaminosis. The patient was presented with loss of appetite and renal failure. He was 55, chartered accountant, had a fracture and prescribed vitamin D and calcium. Now his serum calcium was 12.5 and there was no drug in India abroad who can bring down, he was running serious arrhythmias and there was no chelating agent available anywhere. So is the point that vitamin D should not be used like a B complex in every case?
We get your point. About the hypervitaminosis D, the point. I think you can respond to both. Yes, Kaushik?
Of course, that holds true for any sort of pharmacological agent, that if it is abused, it will definitely have a bad impact, no doubt about that. So let's probably assign a more important level to vitamin D, calling it not a vitamin, but rather a pharmacological agent, and putting it, so to say, in a Schedule H drug so that it should not be abused and be available over the counter. That certainly is important.
Arun, your comments on the black skin and the normative values. We have got 7 minutes left.
Yeah, I think it's definitely something which we need to look at there, because I don't think there is clear data as to what is normal for dark skinned people. And I think whether what we call as low vitamin D in our population is really low vitamin D, we are not sure. Because we see quite a lot of patients on whom we don't see a response in terms of PTH or alkaline phosphatase or any bony sort of this thing, and you still see low vitamin D. So does that mean that it is actually low levels? Nobody is sure about that.
Yeah, I think you have given the answer. The issue has been partially addressed by the studies by Dr. Goswami, Ravindra Goswami and all, who gave the values of 30 and 15. But Dr. Sahab, as you rightly said, there exists room for further inquiry into the real levels in our population. Yes, doctor, very brief question.
Yes, the optimal or the ideal duration of the therapy, 12 weeks, 8 weeks, 6 weeks, and level, any evidence on that, how should we go about the measured level and the duration?
I think it's
as I have said, that we are still looking into vitamin D from the glasses of bone. So we really know about how much of vitamin D is essential, how much of vitamin D is good for the bone, how much of vitamin D is excess, and etc., etc. We do not have an idea about vitamin D vis-a-vis the cardiovascular disease or diabetes. So that way we really do not know. And not to mention or complicate the scenario, we do not have a very clear-cut level in which you can say, well, this much of vitamin D is enough for cardiovascular disease. So vitamin D deficiency has not been defined in its entirety.
Thank you. We got to answer. Last 2 questions.
See, my husband, my son, they are orthopedic surgeons. So I have an endocrine, E411 Roche for vitamin D. And we do for most of the patients. And initially, before starting this, about 1.5 years back, we did vitamin D for all my family members and also to all my clinical staffs. All are young staff, younger individuals. For none of them, the level is normal. For many of them, it was below 7, and some of them, it is below 20. And not a single person had about 20, which is a normal level.
Thank you. I think it's a comment.
Yeah.
Yes.
And should we replace even for a normal individuals the vitamin D?
Yeah,
of
the question is, we get your point, madam. The issue is that madam has found that the levels are below 20 all the time, some person as low as 7. That's why she's asking whether you should replenish vitamin D in such populations.
I think the simple answer to that is yes, perhaps, because I think we are, I mean, again, not based on very clear-cut evidence, but if it is vitamin D deficiency, then we have to treat, as, at least for the skeletal effects, certainly we should treat it. Now, if it continues to be like that, that is more difficult to answer, because I don't think there's any clear-cut evidence to say that, you know, there are people whom we have supplemented and they continue to remain in a deficient state. That's
Thank
what
you.
we are saying.
Last
Sir,
question.
One more thing, sir.
Be very brief, madam.
So for all these orthopedic patients, once they give 60,000 units for 8 weeks, and then after that they follow up them for some of the patients with 1,000 units per day. But supposing the patients are not taking, when they did it after 60,000 units for 8 weeks, when we repeat it, the level becomes normal. It goes up to 70. But once the patient does not continue the 1,000 units per day, after 3 months or after 4 months, if you repeat the vitamin D, it goes back to the lower level.
Any comments on that?
Well, if you ask my personal observation, I do measure vitamin D in many of my patients, and most of my patients do have diabetes and cardiovascular disease and so on and so forth. So they are definitely a population where vitamin D deficiency is running rife. I cannot recall more than one person whose vitamin D was, so to say, normal in the last 6 months. And whether vitamin D supplementation in all would be beneficial is not really known, but it's a common concept that if something is deficient, you need to replenish.
Kaushik, thank you. The question is very specific. Whether, I mean, there are a lot of controversy as the first questioner asked. The issue is that whether after giving 60,000, you will like to give 1,000 as a follow-up, or you will not like to give.
I mean, we do not have any guideline. We really
Fine.
do not know.
Fantastic. Last question.
Yeah, my study was based on vitamin D, and I found that persons who are working in day shift, they had normal levels of vitamin D, and persons in night shift had completely very low, and they all became metabolic, they came under the category of metabolic syndrome. Now I'm studying them again, and what advice should I give? If you have told that supplementation is not going to change anything, then should we start supplementing from birth, like continuously till the end, monitoring vitamin D?
Thank you very much. I think the question has been answered, but thank you, madam. Thank you for your comments about the shift workers. Before I conclude, I would give some comments which are supposed to be balanced view, but you can judge whether it's balanced or not balanced. Dear friends, that the calcemic effects of vitamin D is well above board. The non-calcemic effects of vitamin D has been under a debate, and the organizers have rightfully chosen the topic because to discuss the multifarious aspect. The debate is to bring in the multifarious aspects of a problem, both pros and cons, and probably arrive at a balanced view. Dear friends, suffice it to mention that there exist some anti-proliferative, anti-apoptotic, pro-differentiative, and anti-angiogenesis effect of vitamin D. There exists, and this has been shown, not as Arun mentioned, not in the human models. This has been shown so far in the animal models and also in the lab. And the association also exists. I'm telling association, I'm not telling the causality. The association also exists between the various types of cancer, to name them the breast cancer, the prostate cancer, the colorectal cancer, the 3 cancers where the low vitamin D association does exist. But the causal relationship between the two has not yet been proven. The third issue is that there are so many other variety of conditions like chronic fatigue syndrome, like muscular pains, like various myriads of other issues where there is vitamin D levels are low. But again, we do not know the Cox postulate or the Woods postulate has not been proven in these situations. Last and final thing is to mention that the VDR, the non-calcemic moiety of the vitamin D is on the anvil. The JCI paper, which published in 2001, 2006, and again this year, has proven that there is active investigation to get this non-calcemic moiety of vitamin D, which, as our esteemed speaker spoke about the drawbacks of the moiety of vitamin D, which will be devoid of this. Therefore, dear friends, the final answer is that there exists vitamin D deficiency in certain population. There exists some association, some studies showing the low vitamin D in these conditions I elucidated. The antioxidant property also does exist vitamin D, but Arun has shown the antioxidant property in other moieties which has not stood the test of time. And there are studies which are ongoing today, which is published today in the Lancet Endocrinology in 2014, and the 2017 will possibly have the final answer. Till then, dear friends, thank you very much for a patient hearing. We hand over the forum in the right time. And a big hand for both the speakers, and there was no white flag.